Adamawa State have fared very well with the prudent management of the program manager, Mr. Mohamed Bello, guided by the national coordinators, Dr. Okara and Dr. Kana. There was a time Adamawa State came first among the states in performance after a smart survey was done. And we've continued with that. We came second at the time, and by and large, the performance of Adamawa State was exceptionally good. And this is all due to the prudent performance of all of us here. Once more, I congratulate all of you for a very job well done until the close of the program. Congratulations.
I bring for familiarization of all our health facilities outside Yola. One of the most striking intervention we found on the ground was the European Union and this program, Save 1 Million Lives. And they have performed so well that I wish government of Adamawa State will just give all money allotted to health sector in the budget to save 1 million lives.
So as we develop this plan, my prayer is that we should be guided by those results. Effectiveness to achieve them. Efficiency, let's use strategies that will give us more value for those resources to be used. And quality, whatever we do, has it met the standard we have set? And lastly, I want to draw attention to sustainability measures. We in the primary healthcare subsector, we have some interventions globally. The issue of DFF is coming. All the activities are moving to financing facilities. So in order to sustain these things, our prayer is that we are prepared for a number of activities. We just want the initial setup for those programs or projects to be captured in this plan so that we'll be able to reach more children, more pregnant women, and more people that need those preventive and curative services.
Over time, we have seen how they perform. There is no denying the fact that the project has done excellently well. As earlier, stated by you, and also the awards they have collected in the past. For us at the coordination office, our focus or areas of interest has been harmony between projects to deliver the common goals. Secondly, we look at how we can remove suboptimality of poor performance. Thirdly, we look at how we can eliminate duplication of efforts. And lastly, we look at value for money.
But I think I'm very pleased that the Honorable Commissioner is taking the lead to bring together all the key stakeholders in the state under the umbrella of the 1 Million Lives Program for Results to develop an annual operational plan, which really is the backbone and also setting the stage for implementation of healthcare delivery in Adamawa State. Indeed, you can see the state insurance scheme, the primary care agency, and all the agencies actually coming together along with various departments within the State Ministry of Health. That is the only way that leadership can be provided, governance can be instituted, and also enshrining accountability and transparency in providing healthcare delivery in the state.
My name is Dr. Okara Dogara. I'm the national coordinator for the Northeast and North Central Saving 1 Million Life Program for Results. Adamawa State is a state that has a lot of experiences for other states to even copy, in the sense that they have committed human resources. They also have human resources who know their onions in terms of capacity. They are also, there is this unity of purpose and harmony amongst them. Unlike other states where you see people working, having fragmented and vertical approach to issues and what have you. But there is this ambience of unity you see in Adamawa State, and that alone is enough to give rise to the performance they are having. Oh, wonderful and satisfactory. Because by the time you compare Adamawa State to other states, even within the Northeast, Adamawa State is one of the states that have consistently making progress from the inception of the program. And even as I speak with you, they are still making progress. And the fact that they are here today to develop a robust work plan and bringing on board every part, every sector of, every component of the health sector to be part of this work plan development is a demonstration of their transparency and accountability and unity of purpose for working together.
I know we are used to many of these slides, and also look at it here. Looking at it here, it's very important we look at the various gateways, the MPSC gateway, the NHIS gateway, and the EMT gateway. However, we are still on the journey. We are yet to start full implementation, but we've implemented quite a number of activities for the community healthcare provision, implementation of basic care in Adamawa State. What have we done? We've had trainings at different levels. We've had a quality assessment conducted even before we came on board in June. All these activities have been conducted. And following this assessment, we sat down as a team at the agency. We identified all these gaps along the 14 areas. And those were the things that we concentrated in meeting and bridging those gaps in order to improve our preparedness. Sincerely speaking, as mentioned, it was a very Herculean task because of the COVID pandemic. At a point we were to have the next level activity, that was when there was this lockdown, we couldn't have the training, it was Zoom cancelling when there was piece of lockdown.
Yes, the aim of the Saving 1 Million Lives from the onset is to increase utilization of high-impact, evidence-based, cost-effective, reproductive, maternal, and child health interventions in Nigeria. And as you are aware, the Saving 1 Million Lives program for results tend to allow gives states the room to compete favorably amongst themselves and within the states. What that means is that, first of all, Adamawa State is competing with Adamawa States because it is comparing with its previous baseline. And then secondly, also compare with the zone as well as compare with other states nationally. Program for result is ending in 2021. We have other programs that are on board. Most importantly is the Basic Healthcare Provision Fund, where it provides finances 1% consolidated revenue to be earmarked to the health sector. And then the health sector is also at liberty to leverage by taking advantage of other donors, spirited individuals, international donors, and local donors into the basket fund. And therefore is going to increase the financial status of the health sector itself, and with the overall aim of having a universal health coverage.
I want to put on record that Save 1 Million Lives Performance for Resolve actually funded the process of establishing the Adamawa State Contributory Health Management Agency, right from the design, conceptualization, and even implementation that has started. It has been very, very supportive, and without it, I doubt if the Health Insurance Agency would have actually taken off. The Save 1 Million Lives supported the process of engagement with relevant stakeholders, the process of passing and enabling law, the process of developing working tools, including operational guideline, marketing strategy and plan, actuarial costing, and even development of the benefit package. And so that facilitated the takeoff of the agency, and the agency has now started enrollment of the vulnerable population in the state. This is one legacy, sustainable legacy, that Save 1 Million Lives has achieved in the state. As the program is coming to a close, the Health Insurance Agency is expected to actually be a sustainable funding mechanism that will help to sustain the gains of Save 1 Million Lives in the state.
I think the Adamawa State, in the last 45 years of implementation of SOML, Adamawa has consistently been among the best. Indeed, Adamawa State is among the only few states in Nigeria that consistently earned funds from all the disbursement that took place at the national level. What does that mean? Adamawa State is in a positive trajectory and has continued to improve and will continue to improve in providing healthcare for its people.